Hey guys, this is Dr. Sandy with your health tip of the week. So what I'm going to be going over is the stretches that we give all our patients who come to the class. If you haven't been to the class, please come to the class. If you are not my patient, please work with your healthcare practitioner. It goes without saying, whoever you are watching this video, if any of these stretches cause any pain or discomfort, immediately stop, contact a health professional. Obviously, if you're a patient, talk to us. So here's the intention with stretches. They should feel good. They should feel like they're opening up the body, relaxing you. If you're feeling sharp, stinging pain or something not right, or you're not even sure, just take a break from everything and it should feel refreshing. Before I get into it, what are we expecting from our patients? We used to ask once a day. We're actually asking twice a day, ideally morning and night. If you can't do that, you can do like 6 p.m., 8 p.m., but we do want twice a day. So looking at this, the first one, really simple. We're just going to get the shoulders, and I'm going to actually show you the version that you can do at work because I know so many people are short on time. Really simple. You're going to hold it, just going to hold for a few seconds and then come back down. The next one, number 2, we're going to get the hands. We're going to put them up like this, and again, you're just holding that position. For number 3, you can either hold that position or just going to the side, and again, you should be feeling stretched throughout this whole area. We're obviously going to do both sides with that. Number 4 and 5, really easy. Number 4, and what I recommend, the sheet actually just shows this. You want to twist your whole body, get into it, and then to the other side, same thing, you're going to do that as well. Now, if you know when you look at the sheet, there's also number 5. Basically, the intention is there should be a stress on the chest area, pectoral muscles, going into the arms. So when you're standing, you just want to go back like this, have the chest go forward. Number 6, I don't recommend. There is one with a towel. I'm not really a fan of that. But what you want to basically do is you're standing, have this go up as high as possible. Even for myself, that's as high as I can go, that's fine. Now, number 7 and 8, you're usually doing on the ground. I want to show you the equivalent. You would have access to a chair or a counter, a kitchen counter, or your office desk. And what you want to basically do is find something that would have you supported at this height. And all you have to do is just lift the leg like this on one side, then the other. And again, with this stretch, you should be feeling it on the inner side. The other stretch is number 9 and 11. I've actually combined it. What you're going to do is just have the feet cross over, and you're just going to twist your whole body as far as you can. It feels so good, especially if you like golfing. This is a great stretch. And then you're going to cross over, obviously, to the other side and do the same thing. Okay. Number 12, if you're at office, obviously you don't want to lie on the ground. You're just reaching for the sky. And again, you want to feel a stretch all the way from top to bottom in the front. 13, what you would be doing, again, using the chair, you would just do this. This is the equivalent. And now I'm making it a little more advanced. The intention should be a good stretch right over here in the front, but just going over like this, and then the other side, starting this way, and then a more advanced stretch would be this way. Really simple but powerful. 14, you just want to do a lunge position. You want to get down there. Now, some people, if it's too tough, you can use the knee for support. If you're a little more flexible, you can actually go like that. You want to do that on both sides. 16, what you want to do is just really simple. You're going to find a wall. Actually, we'll just use this one over here. So you can just put the hands like this. I know in the picture it shows it this way, but you're going to put your hands like this and you're stretching. And the foot should be flat in the back. That feels great. You should feel a good stretch just going throughout the whole leg over there. And then the other side you want to rotate. Okay? So that's how you want to do that one. And then the last one, number 15, you're just going down as low as possible. Okay? Now, with these stretches, I just briefly hit on them. If you still have questions, you can ask us about it. One thing we're finding also, we're always making things better. First we said once a day to our patients, now we're saying twice a day. For some of these stretches, some patients were completing this in 2-3 minutes, which is a good starting point, but once you really get the hang of this, they should be actually taking you 15-20 minutes. It should not be something you're just trying to rush through, trying to get done as quickly as possible, but 15-20 minutes in the morning and nighttime would be awesome. You want to get to the point, again, you memorize this for the rest of your life. 7 days a week you're doing this, even if you're traveling. I know sometimes we tell people like you should be doing this, when you travel. Really, it's not a big deal. You don't need any equipment. So even if you travel, you should be doing these. And I know a lot of our patients kind of fall off track, which we understand. But again, really twice a day, even if you travel wherever you are in the world for the rest of your life, you want to be doing these stretches. So really hope that helps you. If you have any questions, let us know. Just as a side note, obviously this is a great precursor to yoga, which I'm a huge fan of. Only thing with yoga, listen to your body. Certain poses for certain people, depending on your x-ray, may be tough, but yoga, I love that kind of stuff, the stretching. Tai Chi, also I highly recommend. I love the Asian arts about working with the body, which is beautiful. So other tools you want to start looking at. And another thing I want to clarify as well, some people look at this and they'll actually call this exercise. It's good. It causes flexibility, and depending on where your health level is, I understand that. But as you start to get stronger, you should not think that this is enough. This is a warm-up. We're making the body more flexible. You still need to do cardio. You still need to do resistance training when it's at the appropriate time. But don't think that just doing this is your exercise. It's not enough. So again, thanks for listening. We are, again, office has been very busy. We always appreciate your referrals. We're reaching out to more and more people. We definitely need your help. So please tell your family and friends. We want to touch as many lives as possible. And end of September, on September 25th, we are having one of my personal favorite classes, Power Energy, 1 hour about things you can do to keep your energy high at the highest level. Just so you can feel good throughout the day, produce more, accomplish more, but you need energy. So we're going to talk about natural ways to boost energy, September 25th. September 19th, we're celebrating Patient Appreciation Day. Chiropractic's birthday is coming up. I believe it's 117 years, so we're kind of celebrating that as well. Thank God that we have a profession like chiropractic, so that's also going to be tied into the Patient Appreciation Day, September 19th. And then just so you also know, September 20th, 21st, I'll be gone for further training. I'm actually going to be working or observing a Dr. Criseno in the States who has a very, very successful practice. He takes care of a lot of patients. I'll be working with him, learning from him how he's helping his community, how he's changing lives as well, and passing on that information to you. So God bless, we love you. A lot of changes in the office, a lot of excitement. We'll see you next week.